I was an assistant head nurse, a supervisor, a night supervisor, a day supervisor, director of nursing, all those other things that kept me busy. But teaching, I find even around here, when we have a few students in from the college here in the PS, Personal Service Worker Program, and they'll be in doing something for Marion, and I find myself going in and saying, now, when you wash her, you got to make sure you do. And one girl said, nobody ever told me that. I said, well, I'm an old teacher, and I'm saying it with love, but your patients really need this kind of thing. And a couple times afterwards, she said, I'm really glad you mentioned that, because she said, nobody ever told me I should get right up in the crease at the back. So I guess once a teacher, you're always a teacher. Once you're a nurse, you're always going to be a nurse. And my mother was a nurse, and although she used her nursing skills to look after the birth of 4 children in 4 years, I don't know how she ever did it. I was the youngest of them. So, there was good basic training there as well. But Marion also, she just, in my books, sort of epitomized what a nurse should be, and the combination of being very skilled, doing things properly and well, no shortcuts, but always considering the patient's personal needs first. Would you agree with that, Marion?
I would agree with that.
Now, Marion, my recollection of teaching with you is you were always obstetrical teacher. Were you always teaching?
Well, not always, no, because the nurses had to start somewhere, so they were beginning students sometimes too, so we had them as
Med-surg.
as what?
In med-surg nursing.
Med-surg nursing, yes, in the beginning times. And then after they had their basic program, then they went into specialties, and so we looked after the special things that they needed to do, and one of them is obstetrics.
Yeah.
And so we got involved in that as well, and then we carried on pretty well in obstetrics with
Right.
Marion was
Yeah.
also the clinical coordinator for the clinical experience of students, and she worked with all of these hospitals in arranging experience for the students and their consolidation period at the end of their 3 years or the end of their 2 years. And so she was our real link with the hospitals. And if anybody, any of the directors or whatever had any problems, Marion was the one that heard about those things.
Did that role carry over at Humber as well, Marion, when you started there? Coordinating with the hospitals?
no, we didn't.
No.
I don't think we had it at that time then.
No.
The program there was really sort of established by Jocelyn Hezekiah and Ann Bender and so forth, and they were really even though we moved into the facility, the program that Humber had started got to be the base. And so when it got to be there, Marion, I think, is included in the pictures there as a first-year teacher
Right.
in the Humber
Right.
program. Yeah.
Which was the name of the hospital besides St. Joe's where we taught first year? It was sort of a long-term care facility besides St. Joseph's? I can't remember the name. Our Lady of Mercy. Do you remember teaching there maybe? No? So did Jocelyn take over from you sort of in that principal role when you went to VP?
No, Lucille Pizzat
Oh, okay.
had that responsibility, but Jack Buckley was made principal of the Osler, Covatus, and North Campus of the nursing.
Oh,
It was
okay.
Jack. And then, I don't know, he sort of disappeared out of the picture, and Jocelyn became
Moved in, yeah.
in that.
Okay.
And certainly when I left Toronto, she was in that role.
Mm-hmm.
Lucille had left and was off doing something else.
Mm-hmm. Yeah.
And of course, Anne unfortunately died.
And so did Jack.
Did he?
Yeah, yeah.
So,
Well, that's wonderful. So, is there anything you'd like to add, Marianne? I think that's just
I don't
amazing.
think there's anything else that it was It was a program I said I didn't want to enter into any clinical program. I was a bedside nurse, and that's where I wanted to stay, to be there. But I realized that I have to help as much as I can, so I helped along the way. And
She was a good teacher in the classroom too, really.
I know.
It wasn't her first choice, but she was good at it. As you had experience with her when you first started.
Yes, yeah. She was my role model. Marion, you were my role model. You truly were when it came to being that kind of teacher that I would always want to be, so I appreciate
That speaks nicely.
That's very good, thank you.
Just in closing, I would like to say that I think that while the government was criticized a great deal about the regional schools, I think they were a good starting place for the community college programs. And I think that between the 6 schools, several thousand nurses were put out into the area to work, and these schools were started at a time when there was a real shortage of nurses, and the government was looking for some way to get nurses educated and out into Ontario hospitals and so forth, rather than going down to the States or something like that. So I think it met a real need, and I think it was a good precursor to the community college setting.
A nice
that
transition.
we still are now.
So was Nightingale a regional school?
No, Nightingale was I think it was started as a project with, trying to think of her name. It was an independent school of nursing.
Okay.
And it worked in several hospitals, but its objective was to develop the 2-year program.
Okay. And what
And
would
it
be
did.
another regional school?
Well, there was one at Scarborough, there was one in North York. Donna Wells was in charge of that one.
Oh, okay.
A gal by the name of Brown was the director of the one at Scarborough. There was one in London, there was one in Kitchener. I believe there was one in Windsor, although my memory doesn't serve me too well on that. And then, of course, we were in Weston. The great emphasis was in the Toronto and suburban area because there was such a need for nurses in that area. And there were so many of these hospitals that were getting the nurses, but they weren't doing anything towards their education. And I think it made them also, as they had these people for a whole year when we were 2+1, or when if they had them even for a 3-month block or something, they got to know these people, and when it came to hiring, they had some idea whether this is somebody they wanted or didn't want, And so I think it helped that situation. And I think in spite of the criticism, the money was well spent. And it sort of breaks my heart when I see the Osler residence building sitting empty and so forth, but that's one of the things that happens in our modern society today, and you have to move on and do the kinds of things that we've done since then. And I think it's great that we've now been able to marry the college and the universities together, because I think the students do need to learn to think and stuff, but they also need to learn to do. And they've got to learn to use their hands and their heads at the same time. And so I think that the combination is a good one, and I, as an old nurse, support it.
Excellent, yeah. Excellent. Well, thank you so very much, both of you, for spending time with us and giving such a huge part of your day.
Our pleasure.